Hello and welcome to Health Academy. Today we'll discuss about iterative learning. We'll uncover why it's not just effective but also stands out from traditional one-time trainings. Low dose and high frequency in learning process encourages learners to engage with the material regularly, promoting consistent exposure. This consistency helps prevent the forgetting curve, where information fades from memory over time without reinforcement. Breaking down learning into low-dose sessions helps manage cognitive load. Learners can focus on digesting smaller amounts of information during each session, reducing the risk of overwhelm and enhancing retention. Rather than long one-time event, ongoing training and application of knowledge in practice can increase retention of knowledge. Audio and video formats often allow for learning on the go. People can listen to podcasts or watch tutorials during commutes or other activities, making the most of their time. Visual and auditory elements can make the content more engaging and interesting. Dynamic presentations, animations, and real-life examples in audio and video formats can capture and maintain learners' attention. Seeing and hearing real-world applications can enhance understanding and bridge the gap between theoretical knowledge and practical implementation. Some audio and video tutorials and podcasts incorporate interactive elements, quizzes, or discussions, fostering active participation and reinforcing learning outcomes. Audio and visual stimuli can create stronger memory and emotional connections. Memorable content is more likely to be retained and recalled when needed. Additionally, for those who find reading challenging or unappealing, it can indeed pose a barrier to certain aspects of learning process, such as assessing information, understanding complex concepts, or engaging with educational materials. In such cases, audio and video-based contents can help learners overcome this barrier. Well, look at this little fella, running fast but not going anywhere. That's what repetitive directionless learning can feel like. Attending trainings over and over but not feeling like you are getting any better. Let's explore the strategies for breaking free from the hamster wheel of learning. Iterative learning encompasses a cycle of learning, repetition, and practical application of knowledge. The effectiveness of this process can be assessed through refinement, self-assessment, and performance evaluation, often facilitated through mentorship programs. By analyzing the assessment results, a more focused and tailored training or workshop can be arranged to facilitate further improvement. The iterative learning approach is highly practical and effective for continuous professional development, in short CPD, at primary healthcare. CPD helps updating the knowledge on changes in healthcare policies, emerging health issues, technological advancements. It updates their knowledge on evidence-based clinical guidelines and protocols relevant to primary healthcare settings, which eventually help them implementing evidence-based practices, adopting new technologies, or enhance their problem-solving skills. Healthcare professionals can improve their problem-solving proficiency and refine leadership and decision-making skills through the effective application of iterative learning. They can develop the ability to critically evaluate information, consider relevant data and research findings, and apply evidence-based approaches to decision-making. Iterative learning may involve simulations and role-playing exercises. These activities simulate real-world scenarios, allowing health professionals to practice risk management and problem-solving in a controlled environment, which eventually helps them gaining practical experience. Facilitating sustainable investment in learning within the realm of international development involves creating a lasting impact on targeted groups. This is achieved by fostering self-improvement, cultivating leadership skills, enhancing problem-solving capabilities, and refining decision-making processes. The aim is to establish a sustainable and cost-effective approach that ultimately empowers the government health system to function independently. Give a man a fish, you feed him for a day. Teach a man to fish, and you feed him for a lifetime. This proverb highlights the need to move beyond short-term solutions towards sustainable development initiatives aimed to create lasting positive impacts. This approach not only addresses immediate challenges but also promotes resilience, reduces dependency on external assistance, and fosters long-term economic and social sustainability. Stay connected for updates on the upcoming Health Academy training portal. Thank you.